Thank you for your interest in the 2019-2020 Lucas County Community Health Assessment. My name is Emily Gensler. I'm the project manager and I work for the Hospital Council of Northwest Ohio. If you started here to review the Lucas County Latino adult data, I wanted to start off by mentioning there's an additional presentation posted to review the methodology of the Community Health Assessment. For example, you'll find information regarding the design, analysis of data, and response rates. Additionally, this presentation is only focusing on the Latino adult population. Please check out the additional presentations for the general adult data, as well as African American, youth, and child portions of the assessment. The full report can be found on Healthy Lucas County's website at healthylucascounty.org. The first section we will be reviewing from the health assessment is Latino healthcare access. The sections underneath fall into this category within the full health assessment. Please keep in mind that the Lucas County Community Health Assessment is over 300 pages in length. We will only be touching on a fraction of each section to just give you a general overview of the type of data that you will find in the full health assessment. Starting with healthcare coverage, 90% of Latino adults had health insurance, which left 10% uninsured in Lucas County. We also ask why adults were without coverage, and you'll see the top response was they lost their job or changed employers. Next, we have a pie chart showing sources of healthcare coverage for Latino adults. The top three sources were employer, Medicaid, and Medicare. Additionally, you'll see options reported out as military, self-purchased, the marketplace, and private insurance as well. The first graph that you'll see in this presentation is reporting Latinos who are uninsured in Lucas County. I do want to explain the graph a bit since this is the first one that you're seeing in the presentation. You'll see the very first bar as the 2020 percentage for Lucas County Latinos. Then as you move on towards the right of the graph, you'll see the data broken down by gender, age, and income. Income is showing household income in the past year. Lastly, as you look at the orange bars to the right of the graph, you'll see old Lucas County data for Latinos starting at 2011 from previous health assessments. Again, this is why it's so important that we ask the same questions from year to year when completing the health assessments so we can see how the data has changed throughout the years. Then at the bottom of the slide, you could see the comparison since 2007 in Lucas County. Additionally, you'll also see national and state level data towards the right of the table so we can see how Lucas County Latinos are doing in comparison to both. As you will see, the Lucas County Latino uninsured rate is lower than both the Ohio and United States percentage. Moving on to our healthcare access and utilization section, you'll see where adults reported visiting for health services when they were sick or needed advice. Our top responses were doctor's office, urgent care, and then the emergency room. It's very interesting to see the changes in where people are going for healthcare services over the years. When looking at the last Lucas County Latino Health Assessment, the emergency room was at 24%, so we can see the decrease in emergency room usage. Urgent care has increased quite a bit from 25% in the last assessment to now 38% in 2020. The next slide is showing some newer questions that Lucas County started to ask during the previous round of health assessments. Especially during COVID-19, advanced care planning is even more important than ever. Overall, 16% of adults reported they had a living will, which you can see increased quite a lot for those 65 and older. And then 9% had a durable power of attorney, which increased to almost a third of adults that were 65 and older. Then of the Lucas County adults who did not have either one of those documents, 34% discussed their medical wishes with a family member or loved one. Next, we have the Preventive Medicine section. This section encompasses a lot of vaccination data for Lucas County Latino adults. First, looking at those who received a flu vaccine in the past year, 65% of the population reported receiving one, with the highest percentage being those 65 years and older. Next, we have our Preventive Medicine section showing comparisons for vaccination data. The flu vaccination data has two separate indicators, one being for all ages and one for those ages 65 and older. All of the vaccination data for Latino adults increased since the last assessment in 2017. Additionally, we see a much higher percentage of Latinos 65 and older getting a flu vaccine than the Ohio and US comparison data. The next few sections, we're looking at men's and women's specific health, mostly looking at preventive exams. For women, we have data for clinical breast exams, mammograms, and pap smears. Overall, more than half of women had a mammogram in the past year. That's looking at all ages. And then looking at the 40 and older population, 73% of those had a mammogram in the past year. All of our indicators here for Lucas County increased since the last assessment, which was a positive finding. Also, we do realize that screening recommendations change depending on what organization you're looking at. We are following the CDC's guidelines for all of the questions within the adult comparison table. For the men's health section, our main question is looking at digital rectal exams, which is a test to check the prostate. Overall, 5% had this exam in the past year, which was definitely a change since the last assessment. And then the 50 and older population is larger at 19% of Latinos. Additionally, Latino men were least likely to have had a digital rectal exam in the past year when we compare to the white and African American populations. The last section falling under the healthcare access section is oral health. First, you'll see that 58% of Latino adults visited a dentist in the past year, and then you can see the decrease for those with lower household incomes. The main reasons adults did not see a dentist was no reason to go or had not thought of it, cost, and then fear. Cost was also at the top of this list in past assessments as well. The last bullet is indicating adults with loose teeth, no teeth, and skipping meals due to pain. Next, we break down those visiting a dentist in the past year the same way you've seen in previous graphs. The lowest percentage were those with lower incomes, and the highest percentage of dentist visits were with high incomes. At the bottom of the slide, you'll see the overall percentage of 58% of adults visiting a dentist being lower than Ohio in the US comparisons. We did see quite a big of an increase since 2017, which was only 39% of Latino adults visiting a dentist. Latino health behaviors is next. You can see all the different sections falling underneath this category, with health status perceptions being first. This graph is looking at how Latinos perceive their overall health, both mental and physical. You can see the categories as being excellent or very good, good, and then the lightest color as fair or poor. The highest percentage of fair or poor health is those with lower incomes, and then also we have the 30 to 64-year-old category being higher than the 65 and older population, which usually we have the highest percentage in the 65 and older. Our comparison table for health status perceptions is pretty large. The second row showing our trends for those reporting fair or poor health, which improved since the last assessment. Overall, we can look at mental health perceptions improving a bit as well, with those rating their mental health as not good, decreasing in this 2020 assessment. Also, when looking at physical health, we have adults reporting less days where their physical health was not good in the past month, from 7.5 days in 2017 to now we have reporting 3.5 days in 2020. Next is Latino weight status with information on BMI, physical activity, as well as nutrition. 80% of adults were either overweight or obese by body mass index, and our statistician is able to calculate this using data from the survey for height and weight. Over half of adults were trying to lose weight, and then you can look at the comparisons at the bottom of the slide, where Latinos were much more likely to be obese than our Ohio and US comparison data. The BMI graph is broken into 3 different categories: normal weight, overweight, and obesity. The highest percentage of those who were obese were lower incomes, with that being the top darkest color that you see in the graph. Additionally, when we compare the white, African American, and Latino Lucas County adults, Latinos were most likely to be obese. And you're able to check out those comparisons in the minority trend summary table within the executive summary of the full report. We have a new question that was asked in the 2020 assessment for Latino adults, and this question is looking at what would help Latinos use community parks, trails, and walking paths more frequently. More accessible and designated safe routes was the top 2 responses. In our bottom bullet, we're looking at physical activity with 58% of adults engaging in physical activity for 30 minutes, 3 or more days per week. 29% of adults did not engage in any physical activity. Our table on this slide is indicating fruit, vegetable, and sugar-sweetened and caffeinated beverages and how often adults were consuming them per day. You can see 5 or more servings per day as well as 0 servings in the last column. Barriers to consuming fruits and vegetables included too expensive, which was also a top response in 2017, did not like the taste, and did not have access to fruits and vegetables. Next, we have data for Latinos for tobacco use, with 14% of adults being current smokers. You'll see how that has changed since past assessments in just a few slides. Keep in mind, current smoking is just looking at cigarette smoking per the CDC's question. Cigarettes are definitely the most popular tobacco product, with 25% of adults using them in the past year. And then we have a new perceptions of e-cigarette vapor harm, which at the bottom, 75% indicated that e-cigarette vapor is harmful to themselves, and 3% reported it was not harmful to anyone. Next, we have Latino smoking behaviors broken down into 3 categories, with current smokers being the lightest color towards the bottom. Lower incomes had the highest percentage at 17% being current smokers. Also, when we compare the adult populations of white, African American, and Latino, Latinos had the lowest current smoker rate out of the 3. The first bullet is depicting adults that would support a ban for smoking in the following places. Every single category in that list has actually increased, so more of the population is supporting a ban when comparing to the 2017 Lucas County Health Assessment. Additionally, when looking at the comparison table at the bottom of your slide, we have less adults being considered current smokers and about the same percentage of those trying to quit smoking. Next, we are reviewing the alcohol consumption data for Lucas County Latino adults. 53% of adults had at least 1 alcoholic drink in the past month. This is defined as being a current drinker by the CDC. 37% were binge drinkers, which the CDC defines as 4 or more drinks on occasion for females and then 5 or more for males. And then we ask the reasons why adults are not using a program for themselves or a loved one to help with alcohol problems. The top response being stigma of seeking alcohol services as to why they are not seeking a program. As mentioned in the previous slide, 1 or more days drinking in the past month defines someone as a current drinker by the CDC. So we have this graph broken into 3 categories, with did not drink any alcohol being that lightest color, and then 3 or more days as the darkest color. Those most likely to be in that darkest category of 3 or more days was 65 and older for Latinos, and then also males at 59%. Our comparisons are indicating current drinkers lower than the 2017 assessment, but still higher than Ohio and US comparison data. Also, the last indicator in the table showing drinking and driving, and that has doubled since the last assessment. The next section is Latino drug use, with 3% of adults being prescribed opioid-based medication and had trouble stopping. Then, as a result of using drugs, adults indicated any of the following about themselves or someone in their household, with 2% having legal problems and 2% failing a drug screen. Towards the bottom, you will see some NAs in the comparison table that is depicting that the data is not available. The CDC does not ask drug questions on their national survey or state survey due to more of a sensitive nature for these topics. We do have quite a lot of comparison data, though, from 2007 all the way to 2020, with less adults using marijuana in the past 6 months, and then no change in both heroin use or misusing prescription drugs. This graph is depicting 30 to 64-year-olds as most likely to use marijuana in the past 6 months. Additionally, we have females much more likely to misuse medications in the past 6 months for Latino adults. 3/4 of Lucas County Latino adults had sexual intercourse in the past year, with 10% having more than one partner in the past year, which is indicated in the comparison table. 11% of adults were forced to have any sort of unwanted sexual activity, which increased for both females and those with lower incomes. Also, as you can see, 29% that were forced to have sexual activity reported it. Mental health is the last section to fall underneath the health behavior section. The first bullet is 4% of adults considering attempting suicide in the past year. You can see this decreasing in our comparison table at the bottom of the slide, which when comparing the adult populations for Latinos, African Americans, and white, this is the only population to see a decrease in suicide contemplation. Also, 1% of adults actually attempted suicide. And then our second bullet, we're looking at 43% of adults not getting enough sleep or rest, 36% reporting high stress almost every day for 2 weeks or more in a row. To finish up the mental health section, the slide is showing what prevented adults from using a program or service for both themselves or a loved one to help with depression, anxiety, or emotional problems. 13% had not thought of it, and 7% reported fear and did not know how to find a program. The next category is Latino chronic disease, which encompasses all the sections you see on this slide. We will first start with cardiovascular health, where we will look at high blood pressure and high blood cholesterol. This graph represents those actually diagnosed by a health professional with high blood pressure, the highest percentage being those ages 65 and older. Same trend with the high blood cholesterol graph, with the 65 and older population being 43%, so the highest diagnosed with high blood cholesterol. Our indicators here on the trend summary table are showing high blood cholesterol increasing since 2017, but we also see more people getting their cholesterol checked in 2020 in the past 5 years. Those who survived a heart attack also doubled since the last assessment to now 6% of Latino adults. Next, moving on to cancer, 7% of adults diagnosed with some form of cancer in their lives, increasing to 25% of those 65 and older. Of those diagnosed with cancer, you can see the top cancers that were reported, with prostate, ovarian, and testicular being the top 3. Also, we have the last bullet indicating adults who had different types of cancer screenings, with the highest percentage being colorectal cancer in the past 5 years. Moving on to arthritis, 11% of adults were diagnosed with some form of arthritis, which increased with age. You'll see that percentage decreasing from the last assessment. In 2020, 13% of adults were diagnosed with asthma, which is much lower than the Ohio Latino percentage at 24%. And then 71% of adults with asthma were receiving treatment for it. Additionally, 1% of adults were diagnosed with COPD. We have a higher percentage of Lucas County adults being diagnosed with diabetes than the Ohio and US comparison, but we did see a slight decrease since the last assessment. 41% of adults that did have diabetes rated their health as fair or poor, and then a high percentage of adults reported receiving treatment for their diagnosis. The graph is breaking down those diagnosed with diabetes, with the highest percentage being the 65 and older population, as well as lower incomes. We are wrapping up the chronic disease section with quality of life. The first graph showcasing those that had a limiting health problem. Back and neck problems were reported as the top limiting problem for Lucas County Latino adults. The last category that we'll be covering is social conditions, which we will touch on social determinants of health and environmental conditions. According to the CDC, social determinants are conditions in the places where we live, learn, work, and play that affect a wide range of health and quality of life outcomes. This section is divided in the report into the 5 key areas of the social determinants of health. That encompasses economic stability, education, social and community context, health and healthcare, and then lastly, neighborhood and built environment. We cover some of these topics within the next few slides, with the first looking at food insecurity in Lucas County. 8% reported a loss of income led to food insecurity issues, and this was double compared to the percentage for the general adult report sections. 8% were worried food would run out, and then 7% experienced more than one of these issues in the past year. This next slide is looking at adverse childhood experiences, or ACEs, as we like to call them. These ACEs are traumatic events that occur in childhood and then affect health later on in life. So the question states, did any of the following occur under the age of 18? And some options included were experiencing violence, abuse, witnessing violence, or having a family member attempt or die by suicide. These ACEs, again, are linked to chronic health problems, mental illness, and potential substance misuse in adulthood. This question was actually asked in all the population surveyed in the health assessment, so you're able to see how this changes depending on the population you're looking at. For the ACEs question, we look at those who experienced 4 or more. As you can see, the highest percentage was for females at 36%. Additionally, we have 27% experiencing 4 or more, and this is almost 10% higher than the African American population. Next, we had quite a few questions looking at discrimination in the health assessment, which could be based off of skin color, ethnicity, religion, etc. When asked if adults experienced feeling emotionally upset as a result of those categories, most felt emotionally upset based off of their ethnicity and then skin color. Additionally, 14% of adults reported feeling emotional or physical distress based on any of those categories. Also, we have a question that looks at experiences when seeking healthcare and if adults felt they were treated better, worse than, or the same of different races. This question was broken into African Americans, whites, and Latinos. With the highest percentage of those feeling their experiences were worse was the African American population, and also the white population had the highest percentage reporting their experiences were better than other races. Lastly, we have environmental health, with bedbugs and mold being the top responses when asking what is threatening Latino adults' health in the past year. Thank you for your interest and time in reviewing the results of the 2019-2020 Latino-specific sections of the Lucas County Community Health Assessment. Please remember to review additional sections if you're interested. We also have African American, youth, child, and just the general adult population portions of the presentations. Of course, you can also check out the full report on Healthy Lucas County's website. Before we finish, I also want to encourage you to fill out a participant feedback survey with more information coming up on the next slide. Here you'll see the link to our participant feedback survey, which is on the SurveyMonkey platform. We ask questions that will help the executive committee move forward with planning for their next community health improvement plan. This is the next step of the process, and we thank you so much for your time.